Okay, so now I'm practicing to do my NG2. So I would have the patient sit up in a high Fowler's position. This isn't ideal, but I would wash my hands, do hand hygiene, and then I would rip I would make sure I have a clean surface. I would clean this off. My last piece of tape, I'm going to rip it down the middle. And then I would put on clean gloves. I would use my pen light to look in the patient's nose. Okay, can you breathe in and out? In and out. Okay. And have you had any nosebleeds, any damage, or anything to your nose, surgeries? Okay, it doesn't look like her septum is deviated, so I would use the right side of her nose. So then I would
measure.
Yeah. So then I would measure from the bottom of the nose to the tip of the earlobe down to the xiphoid process. So that would have me at 50. And I would mark that with a piece of tape. And then I would have a syringe connected to this part, and I would lube the tip of the tube about 4 inches. So then I would start putting it into the nostril, making sure to let my patient know it will be uncomfortable, but if you need me to stop, just raise your hand. So I would start by putting it back towards the back of the throat, towards the ear. Then I have the patient tilt their head to their chest and offer water and tell them to swallow. Keep swallowing. So I would have it stop to the nose. At this point, I can just have it connect. Have it connected, not fully, because I may need to adjust it. Right there. I would pull back on the syringe, and I would have my pH paper in a measuring cup, and I would put the gastric juices into the syringe and make sure it's between 1 and 4, the pH. Once we have that in, make sure we have it in the right place, and with the x-ray, then I can pin it to properly secure it and pin it to my patient's gown. Okay, end it.
Turn off?
Yes.